Bonsoir à tous et bienvenue à ce point de presse. Le Premier ministre du Québec, M. François Legault, est aujourd'hui accompagné.
Welcome to this press conference with Quebec Premier François Legault, who today is with Health Minister Christian Dubé, as well as the Director of Public Health, Dr. Horacio Arruda. Without further ado, Mr. Legault, the floor is yours.
Oui, bonsoir tout le monde.
Hi, everyone. As you've seen over the past few days, Quebec is being hit very hard by the Omicron variant, like many other places in the world. And for the past week, we've gone from 2,700 cases to 6,300 cases yesterday, and today we should have approximately 9,000 cases. So there's truly a steep exponential increase in cases. And we believe, the specialists believe, that this will have an impact on hospitalizations. Already, since the past week, we've gone from 309 hospitalizations to 445. And so we believe that in the next few days, there will be a big increase in hospitalizations. That is what is our most important objective since the beginning. What we want is to not have the hospitals be overwhelmed so that we can continue to treat everybody, whether it's COVID patients or regular patients. And that is why we have new measures today. First, we are asking everybody that as of this Sunday, the 26th of December, to limit the number of people in private homes to 6 or 2 bubbles, 2 family bubbles. And we're asking the same thing of restaurants, and that is that for each table in a restaurant as of Sunday, it'll be a maximum of 6 people or 2 family bubbles. This means that by Saturday, we are letting people who absolutely want to meet and gather in a group of 10 to do so. However, I invite all Quebecers who are able to postpone these celebrations to do so. And also, once again, we're asking to have only one celebration, either the 24th or the 25th of December, for example, but not both nights. But the most important thing, it's important that everybody understand this, the most important thing is people 60 and over. We have to look at the numbers, and we see immediately that 70% of hospitalized people with COVID are 60 and up, 70% of these people. So that means that it's truly these people who are at risk of being hospitalized, and mainly people who haven't had their 3rd dose yet. With the Omicron variant, they're truly at risk. So ideally, of course, for people who are 60 and over, perhaps I'll ask to remove this from the front. I could see all sorts of text, and it was confusing me. So I'm sorry. So I'm coming back to people 60 and over. The most important thing is truly people who are 60 and over, who they're the most vulnerable. And this is a question of judgment. Ideally, of course, you stay home. I'm reminding you, the virus can be caught just when we're in contact with other people. So if you stay home, there is no risk. If you must absolutely go to a family gathering or a friendly gathering, well, you must know that there is a risk, first and foremost. And if you are ready to take on that risk, well, there are 4 ways of minimizing this risk. First of all, of course, reduce the number of people. Second, wear a mask. Third, keep a distance of 2 meters with other people. And fourth, on a regular basis, open at least one window in the house to ventilate the space. So if you truly must gather with others, people who are 60 and over, but I'm repeating myself here, that's where we've got 70% of our hospitalizations. Of course, this doesn't mean that there are no risks with people who are under 60. There's still 30% of our hospitalizations that are among these people. So those people as well must make some efforts. And when I ask to make efforts, it's mainly for the healthcare workers. It's been 22 months that our health workers have been on the front lines. And of course, a lot of people are exhausted, and they can also get COVID. It's important to say, we were talking about healthcare workers who got the virus. Most of them got it either from their children or their friends, like all Quebecers. So we must be very prudent. Everybody must do their part so that we are able to continue to treat everybody. That is why we have made some difficult decisions over the past 22 months. I'll remind you, Quebec has always been one of the places in the world, and certainly in North America, where we've got the most strict measures. And of course, we do this first and foremost for the healthcare workers who have been heavily taxed over the past 22 months. The other thing that's important as well, and it may seem obvious, but as soon as you have any symptoms, it's important to stay home and to self-isolate. Now for the tests. Dr. Arruda, I will hand the floor to him afterwards. We have to understand that as soon as we get quick tests, right, for home from the federal government, we deliver them to drugstores. Of course, we don't have enough quick tests for everybody right now, and that is why we have said for the time being, it's important that these tests be reserved to people who have symptoms. And it's important as well that people who are waiting in line to get a real test, what we call the PCR test, well, this also has to be for people who have symptoms. And of course, you'll understand that by going from 3,000 cases to 9,000 cases, well, of course, there's a lot more people. And yesterday, we had 50,000 tests. We're at record levels. But like everywhere else, the number of people to screen is limited. We also want to accelerate vaccination. And the quick tests, eventually, I was hearing the Prime Minister of Canada who said today that he'll send us more. And as soon as we get them, we will send them to the drugstores. And eventually, it can be a precaution that we use. But for the time being, it's important that whether it's a quick test or the PCR test, that we keep those for people who have symptoms. What's also important, and I know once again that there are people who got 1 dose and 2 doses, and now they're a bit fed up and they say, do I really need to get the 3rd dose? Yes. There's really a big difference in the risk between people who have 2 doses and those who have the 3 doses. So we must go get the 3rd dose. Currently, people 65 and up can get their 3rd dose immediately. People 60 to 64 years of age will be able to make their appointments as of Monday, the 27th of December. So please go. It's important. Earlier, I was talking about vaccination. As soon as we got the okay from public health to increase the pace or to reduce the interval between the 2nd dose and the 3rd dose from 6 months to 3 months, well, we accelerated our vaccination. I want to thank all of those who have registered in Je Contribue, all the doctors who are helping us out. We have managed to go from 40,000 vaccines a day to 88,000 vaccines per day yesterday. So things are going well. And we believe that, of course, as we give the third dose, that this will help to keep control in our hospitals. And it's important to say this. The measures that we're announcing this evening, we believe that it's enough to keep control of the hospitals, but we will not hesitate in the next few days, if it is necessary, to add other measures. So it's important for everybody to understand this. Now, I have a message for people who are unvaccinated. First, regardless of what you are reading or listening to, it is clear that you are at much greater risk because you're unvaccinated, and you are putting at risk our hospitals. And I'll just give you two numbers. Right now, for adults, we've got fewer than 10% of adults who are not vaccinated, but they represent 50% of hospitalized persons. That means that if we didn't have the unvaccinated, who don't even represent 10% in Quebec, we would reduce by half our hospitalizations. So it's very serious, and regardless of the reason why you don't want to be vaccinated, I am asking you, if you don't do it for yourself, do it for others, but stay home, because there's a risk, a greater risk, that you will end up in the hospital and that you will overwhelm our hospitals and perhaps stop some people from getting urgent care. And of course, we will talk about postponement. So unvaccinated people, I'm asking you, for Quebec, for others, stay home, please, if you don't want to be vaccinated. A word for all of those who have worked for the past 22 months and who will be working during the holidays in the health network. Of course, we will never thank you enough. I know that it's been difficult, but all of Quebec is counting on you. We need you. The next few weeks will be critical, and it's important to have all of the staff that we can have, whether it's doctors, nurses, all the healthcare workers. It's important so that we can get through this. So we are asking you to make more efforts, and I know that we have asked you for a lot already. In closing, I want to tell Quebecers, over the next few weeks, we will go through a very difficult period, but it's not the first time that our people face a big challenge. And we've always succeeded in having solidarity and social cohesion among us. And I'm confident that because of this, that we will be able as a people to get through this big challenge. But over the next few days, we will need each other. It's not going to be a beautiful Christmas for everybody, so it's important to help others. Call people who are alone and take care of each other. I'm counting on you. Thank you very much. And on this, I will hand it over to Dr. Arruda, who will talk about screening tests. Thank you, Mr. Premier, Mr. Minister. I wanted to take a moment to come back and talk about testing and the use of quick tests at home. I want to tell you that tomorrow there's going to be a technical briefing. Journalists will be invited so that they can ask all of their questions on the different situations. There's all sorts of graphics that will be made available for the population so that they know exactly what to do. You know, right now, we pretty much all know somebody who's had COVID-19. So the cases are increasing exponentially over the past few days, and that has brought us to review our strategy, our screening strategy. The screening capacity in Quebec has evolved quite a bit. We'll remember that in September 2020, we had approximately 15,000 tests a day. Right now, our capacity is at approximately 50,000 tests a day. But right now, with the quantity of cases that there are, we must have a certain approach that will allow to use as effectively as possible these tests. We're at full capacity already, as I said, and given the context, the lab test should be reserved to people, as the Premier said, who have symptoms that look like COVID-19 symptoms. That's fever, coughing, sore throat, loss of taste or smell. So from now on, we really have to go to the screening centers if you are in one of the following categories. If you have symptoms and that you don't have a quick test at home, you make an appointment, you isolate, and you make an appointment to be tested. If you have symptoms and that you do a quick test at home and that the result is positive, you isolate, and you can go do a test in a screening center to confirm if it's accessible for you. But you can rely on the quick test and stay home so that you don't transmit the illness to somebody else. If you were in contact with somebody who has COVID-19, we are asking you to isolate for 10 days and to go to a screening center only if you develop symptoms, COVID-19 symptoms. So you keep an eye on symptoms first and foremost, and if you have symptoms, then you go to a screening clinic. And once again, it's strongly recommended that you take an appointment so as to limit the risk of transmission to others and also to avoid to wait in line, because with an appointment, we'll be more fluid. Now, this new approach will allow us to prioritize people who are the most, who most probably have a COVID-19, and to accelerate the process for everyone. And from now on, the results, the test results, the positive test results, will be communicated to you by email for those who ask for it. People who are infected will have a confirmation quicker, and they'll be able to then inform quicker their close contacts. And you'll understand that with more than 9,000 cases, the public health teams can no longer trace back all of the cases and contacts. So we're asking you, if you were symptomatic and you have a positive test, we're asking you to collaborate to advise the people with whom you were in contact since your symptoms appeared. And quickly, I insist on the fact that it's preferable to use the quick tests properly, either for people who have symptoms. It's not useful right now to waste a test just to see if they're working well. I would also like to talk to you about the importance, one of the most important things, which is vaccination and the famous booster shot. We have to understand that we're accelerating the vaccination campaign over the next few weeks. We saw over the past few days a significant acceleration, and people will be offered the vaccine, the Pfizer or Moderna vaccine, depending on what we get. I'll remind you that these are 2 mRNA vaccines. They function similarly. They are considered as interchangeable. Getting a different vaccine from the one that we got for the first or the second dose is safe. So perhaps you got a Pfizer, and then we'll give you a Moderna. It's absolutely okay. The Pfizer deliveries will be limited over the next few weeks, but if we offer you a Moderna vaccine, please do not hesitate to take it. The booster dose will protect you because the virus is circulating quite a bit, and we'll do all that we can to accelerate access to appointments. In closing, I'd like to call upon your civil sense. Over the past few days, some incidents happen in testing centers or in vaccination centers and in the pharmacies and the drugstores. We understand that people are stressed and worried, but we must remain civilized. We understand that the situation can be stressful for many people, but the staff is there to help us, and we must treat them respectfully. And finally, one last comment, if you'll allow me. I think that you're seeing to what extent the virus is being transmitted right now. I think that the more we come out of our bubble, the more we expose ourselves to risk. So if you can decrease your contacts, even during the holidays, I invite you, I strongly urge you to limit your contacts.
Yes, good evening, everyone. In the past week, the number of COVID cases has tripled. We have today about 9,000 new cases, and we expect hospitalization to continue to increase. Our goal remains the same, to protect our hospitals so that we can continue to treat all those who need it. This is why, as of December 26, private gatherings will be limited to 6 people or 2 family bubbles. The same goes for restaurants. Tables will be limited to 6 people or 2 bubbles. We're keeping the limit of 10 people for Christmas, but I ask you to please cancel your Christmas parties if you can. If you choose to go ahead, please gather only on the 24th or on the 25th. And the most important thing is to be very, very careful with people over the age of 60. You should try to minimize the risk by reducing the number of people wearing a mask, keeping your distance, and opening windows regularly. If you have symptoms or positive test result, please stay home. The 3rd dose of vaccine will greatly increase our protection. People over 65 can now get it, and people over 60 will be able to make an appointment starting next Monday. You should get your 3rd dose as soon as you can. We believe that the measures in place will keep the situation under control, but if we see that we need to do more, we won't hesitate to do it. Christmas will be difficult for many people, so please take a moment to call someone who lives alone. We have to take care of each other. I'm counting on you all. Thank you.
Merci, Monsieur Legault. Nous allons maintenant débuter la période de questions des journalistes.
We will now start the question period for reporters. We've got reporters in the room and some with the Zoom application. We'll start with the French media. 1 question, 1 follow-up question per reporter. Question. You're mentioning the 9,000 daily cases. It seems like we will be postponing treatment soon. How will this be done? Will we take advantage of the holiday closures to prolong it? How will this work exactly? I'll start. First, we'll try to minimize the postponement of treatment. That's for sure. We want to reassure people. But with the number of cases that we've got these days, the big unknown, I must tell you, is how severe is Omicron? And you will see in the simulations that were done by our experts, it's the biggest unknown that we've got currently, to see if will it have the same impact on hospitalizations, or will it be less? We all want it to be less, of course. There was some international monitoring, and our experts have shown us that in some countries where the rate of vaccination is comparable to ours, the number of hospitalizations and the length of hospitalization can be less. But once again, we have to look at all scenarios. As the Premier said, currently, we believe that with the current situation and the latitude that we've given ourselves, Dr. O'Parney and their team have prepared so that we can go from level 3 to level 4 of postponements, and we believe that that's enough. If ever we need to do more, we will do more, but that is what we're following, and that is why we're very transparent in our data. From the INES that were published today, I don't know what time they came out exactly, but that is what will be our biggest variable over the next few days. You talked about tracing, contact tracing. Are we to understand that we no longer have the means to do contact tracing, that it's too complicated, and that we are putting in the hands of contaminated people the responsibility for calling their contacts? Perhaps I can start with that, and Dr. Arruda can add. The reason why, well, first, you've said it well. We can no longer do contact tracing as we did previously, and we saw this over the past few weeks, particularly with Montreal. Dr. Drouin showed that perhaps the staff could be better used elsewhere. And since we have a lot of people who are doing contact tracing, and that right now we're at close to 80% of Omicron, I think that the staff perhaps would be better used vaccinating. So that's what we're doing, because we say to ourselves, when we're at 80 or 90%, I think that we know, and with 9,000 cases, and that's why we're asking people, and I will let Dr. Arruda add to this, but we are asking people, when we call them up, we tell them, please inform those that you have seen over the past few weeks or days and hours, inform them yourself, and that way we can reassign the staff elsewhere in vaccination. We knew that we would come to this point. You have to understand as well that more and more we're going towards a new paradigm, self-management of the illness. And at some point, when a variant like Omicron, which is very transmissible, from the time that the person has symptoms and that they do a test and we get the result, they've already contaminated all sorts of people. So we don't have the same efficacy to stop or contain the transmission. So now we're going towards self-management, self-teaching, measures, and we're going to add screening tests, etc. We were already going towards this transition. We knew that is what we were going to do. But with Omicron, we're just getting there faster because this energy is not effective there. We've got people that are better off going where they'll be more useful. There are some outbreaks that we'll be looking at, but it's useless. The situation, the virus is much too quick for us to do the contact tracing. Question? Mr. Arruda, when it comes to the screening, you're talking about self-management, but if there are some people who don't follow your directives, will there be stronger measures? Could we moderate access? So if the lineups don't diminish with the new directives that you're given, what will we do? Well, we get the impression that if we ask people who are symptomatic to present themselves in clinics, we will decrease the pressure already on the people who are doing the tests. There are some asymptomatic people who are doing tests just because they want to go to a party or whatever. We've got some of these people, and that is not a good use of the tests. It's not useful for the person because they can still be infected. So we're going to decrease this, but you'll understand that everything that we'll do, we want to adjust according to the indicators. As the Premier said, if we realize that we're losing control, we will have to add some additional measures. And that is why I'm inviting Quebecers to avoid us going or adding more drastic measures as we've seen in the past to decrease our contacts so that we can get through this peak and so that we don't imperil our healthcare system. So I think that everybody, and I know that there's always some people who will not respect the measures, but the best thing that we can do right now is to get a third dose for those who are eligible and to decrease our contacts and to use social distancing and the mask wearing. Question on mental health. You know that the measures that you're announcing today and those that you've announced over the past few days are creating a lot of stress and isolation. My question is, what concrete measures can we put in place to support Quebecers, psychologically speaking, beyond calling the 811? Or beyond saying take care of each other, what measures can we put in place? Well, my colleague, Lionel Carman, has increased the resources, the phone resources, with the 811 line. We can answer very quickly. I know that there's a lot of people who call right now, but we've put all that we can in place to be able to provide services as quickly as possible to those who are calling us. And secondly, I think that we are conscious of the fact, and that's what the Premier said, let's be conscious of those who are alone, and let's just call them. People are worried. We understand this, but we see an end to things. But we just have to stay strong and stand in solidarity. And those who are alone, we should call them. But on our end, we have increased the capacity of telephone services. Next question.
Anne-Marie Provost, Le Devoir. Si la tendance se maintient, la capacité d'hospitalisation va être atteinte.
If the trend continues, the capacity for hospitalizations will be reached quite quickly in Quebec. Do you have any latitude to add additional beds? And if so, how long would it take? Well, that's what I wanted to explain earlier. Right now, we give you the stats every day. We've got a capacity of, for hospitalizations plus intensive care, a little bit more than 800. With the stats that will come out tomorrow, we'll be at above 55% of this capacity. So we still have some latitude, and we haven't seen the benefits of postponements, of additional postponements that we're working on right now. So there is some latitude. The issue, and I'll explain it so that everybody can understand it, is that we don't know the degree of seriousness of the variant, because most of the people who are in hospital today, when I say that we've got 55% of our capacity that's attained in the hospitals, it's mainly Delta. We haven't yet seen the Omicron effect, because it takes 5, 6, 7 days. We don't yet have the Omicron effect in a hospital. As I've said earlier, and that is what we're following with Dr. O'Patterney, we will look at what is the delay for hospitalization. And that's why, with our experts, we follow what's happening in Europe. They're ahead of us. They've got around 10 days of experience right now, so we're going to look at the length of hospitalizations and the degree of seriousness of the illness, and we will adjust if needed. But I'm telling you now that we have some latitude. Obviously, we see that it's tight depending on the scenarios that we do, but we will act so that we keep this latitude that we need. When it comes to vaccination, how many vaccinators are missing for the time being? In the addition of new resources, is it enough to get through the holidays? I often say that it's important to give good news. We had more than 8,000 people who called Je contribue over the past week. It's extraordinary, and I want to take this opportunity to thank everybody. Of course, within this, there are some vaccinators, and we needed them. But I continue to say that given that we will have a big vaccination blitz in January and February, we've got another 6 million people that we have to give a third dose to. The people who want to raise their hand to become vaccinators, we will take them. So let's be clear. Despite the important number of people that we've recruited, we will need more. Our biggest issue is in the next 7 to 10 days, because in the holidays, well, of course, people perhaps are less excited to come help us, and we understand this. I want to thank doctors. Doctors have raised their hand over the past few days. The people for our specialists, just this afternoon, we were confirming that there's 150 doctors who will vaccinate over the next few days. So the issue for us is to have all that we need in order to vaccinate massively as of the 1st of January, once we will have completed our healthcare workers, which is what we're doing. That's our biggest priority, because it's these people that we don't want to get sick, because we need them. Our vulnerable people, we're almost done with the RPAs. So to answer your question, right now, the vaccinator issue is no longer an issue. It's more that we want to make sure that we have the logistics in place for the beginning of January. And look, today, to have done 88,000 vaccines is already, we're already close to our 100,000 per day objective. So it's going well and will continue. Question? You said that adults, not unvaccinated adults, represent 50% of hospitalizations, and they're only 10% of the population. But these people, you didn't want to be tougher on them by imposing vaccination. But you're imposing closure of cinemas and showrooms. You're imposing restrictions on Quebecers who have followed your measures, who got their 2 doses or 3 doses. You're imposing measures on the most vulnerable and the younger people who aren't very sick. So why not confine only the most vulnerable? They already are. And why not impose vaccination? I think that I would simply say today that if we have to go there, we'll go there. Right now, we're not there. I would also like to say that we've done, well, Quebecers have done so much when it comes to vaccination, so I think that we must respect everything that was done by Quebecers thus far. Now, if we needed to go further, and that is what we've discussed, we will go further. But today, Given the circumstances, we can get through it. But I would like to remind you, Mr. Gervais, that over the past few weeks and months, Quebecers who got vaccinated were able to have a bit of a more normal life, which is not the case for the unvaccinated. The unvaccinated, well, we need a vaccine passport. We've done quite a bit to make a big difference between the vaccinated and the unvaccinated. And I'm repeating myself. If we have to go further, given that the situation could deteriorate, well, we won't hesitate to go further. Mr. Legault, in the spring of 2020, you were transparent. You presented the inventory of medical material with the number of days that we had left. Now we're hearing Pfizer vaccines, perhaps we won't have as much as we wanted, the tests, etc. So I'd like to know, the Pfizer vaccines, how many days of stock do we have? The PCR tests, the quick tests, how many days of that do we have? Medication to treat people in intensive care. And the N95 masks, do we have enough to give some to all healthcare workers? Well, you've got several questions. I will tell you that I want to be very transparent. When it comes to Pfizer, the good news is that we are in discussions with the federal government. And I spoke with Daniel Paré just this morning. We've got what we need to vaccinate. That's good news. That's why Dr. Arruda wanted to reassure everybody. If ever, in the next few weeks, I'm not saying this is a case, but, we've got a lot of flexibility with Moderna. The total of Moderna and Pfizer, we've got enough to vaccinate. We have asked our federal counterparts to make sure that as quickly as possible, we will get some more Pfizer coming in. But I want to reassure Quebecers, we will not run out of vaccines, and even if we increase our capacity. Now, for the rest of the protective equipment, well, it's the same thing. Obviously, we will be able to have the material that we need. What I would say, my big concern right now is to have a lot of quick tests from the federal government. We're still expecting 700,000 this week. 700,000, as soon as we get them, we will put them in the drugstores. You can see the demand for these quick tests. And we will continue to work very hard with the federal government so that they increase the delivery of quick tests. And I would even say that we are considering other alternatives to make sure that we have as many quick tests as possible. I want to be very clear, Mr. Gervais. There is no issue currently. There's no equipment missing. What we're missing is quick tests, and Mr. Trudeau announced today that we will get more. So there's no issue. And since the beginning, we were transparent. If there was an issue or if we were missing equipment, I would tell Quebecers. I was completely transparent, Mr. Gervais, since the beginning, and I will continue to be transparent. And can I add something, Mr. Premier? I want to take this opportunity. Our drugstores, our pharmacists are doing extraordinary work, and that's why when Dr. Arruda spoke to people earlier, I know that it's not easy right now, and we'd like to have more quick tests. But the pharmacists are doing extraordinary work right now. They just finished with the flu shot. They went to the quick test. They're helping us with vaccination. More than 5,000 vaccines were given by pharmacists yesterday, right after they finished the flu campaign. And I want to thank them because they're truly helping us. I really appreciate the work that they've done.
Nous allons maintenant poursuivre avec nos journalistes francophones via la plateforme web en débutant par Claudie Côté, TVA Nouvelles.
Question.
Je vais continuer sur le matériel si vous me permettez. J'aimerais savoir
now, with the material, I'd like to know if we're installing things in hospitals to protect hospital workers. For example, the N95s, hot zones and cold zones. What are we doing to preserve the network and the staff? I would tell you that for the living environments, the CHSLDs, the RPAs, our intermediary resources, we are following the situation very closely because where we need I want to reassure everybody here, it's important. We're not at all at the levels where we were in the first wave, despite the increase in cases. And when we have cases, we're very transparent. We send teams to make sure that we have all the right information, because you'll remember in the first wave, what we were missing was information. And now we have that information. So in living environments, there's no problem. When it comes to the hospitals, so the care settings, we had some outbreaks, small outbreaks, and that's why, unfortunately, we had to restrict visitors. We limited visitors to caretakers, because the issue does not come from inside. The issue comes from community transmission, which is brought in by people who catch it and who, unfortunately, and I'm saying this, I've got a lot of empathy for people who tell us, why can't I go visit my parents, or why can't I go to the hospital? Well, you see the speed at which this virus is transmitted. So we had to limit visitors to hospitals. So you're betting that we'll probably reach our hospital capacity, but that we should make it through, possibly because of the postponements of treatment. So where are we with that plan? What are you telling Quebecers who are waiting for surgery right now? Are they to expect that their surgery will be postponed? Well, that is, we're trying to minimize postponements, and that's why I was talking to Dr. O'Patterney and the CEOs this afternoon. What we have to avoid is postponing urgent surgeries. There will be no postponement of urgent operations and surgeries. What we have to be able to see is what we can delay. It's never pleasant to postpone surgeries, even if they're not urgent. But we are setting objectives so as to minimize the postponements. But there are some Quebecers who, over the next few days and weeks, will be called to postpone their surgeries. I want to be very transparent with people right now. We must put the emphasis on vaccination to protect our 60 and over. And that's what we're working on right now.
Oui, bonsoir.
Question? Concerning the choice that you're making to limit gatherings as of the 26th of December only. This is a third press conference that you're having in less than a week to tighten up the measures. It's a situation that's evolving very quickly, and there are a lot of moving parts. Should we not have immediately reduced contacts as much as possible and convince Quebecers not to go out? What tipped the scale in this case? Well, there are two things. First of all, it's changed quite a bit over the past week. We went from 20 to 10, now to 6. But let's forget numbers. We clearly told Quebecers that it was a maximum and that we had to rely on people's judgment. We also have to understand that Quebecers who are vaccinated, the people who were vaccinated, who made all the sacrifices, are entitled to have a bit of joy over the next few days. And for me, social adhesion is very important. So Quebecers are responsible. The great majority of Quebecers were extremely responsible, and we believe that they will continue to do so in the next few days. But I've said this, and the Premier said, as of the 26th, there might be some other decisions that will be made. But right now, let's try to have a nice Christmas with the smallest number of people possible, given the circumstances. You're announcing measures that are coming into effect the 26th of December. Is there an end date for these measures? Are you able to provide an indication, perhaps, where we'll know that it'll be possible to lift some of the measures? Well, listen, I think that I appreciate your question, but I'll answer you that we don't know right now, to be very transparent. But what you can follow with us is the extent to which Quebecers will respect the measures. Over the next few days, what we have to see is how the situation is evolving in our hospitals. We were very transparent. You have all of the statistics. You can follow along with us, and I would like us to see, despite the increase in cases, I'd like to see us be able to control our hospitals. So the efforts that we're asking of Quebecers right now is to limit the number of contacts. With yesterday's measures, or Monday's measures and today's measures, we believe that we can decrease the number of contacts significantly. We hope that this will be enough. And that is what we are asking of Quebecers, to decrease as much as possible the number of contacts that they have.
Oui, bonjour, messieurs. Je veux savoir si vous avez envisagé...
Question. I'd like to know, have you considered the color levels, because there are still some regional disparities in the number of cases? So is that still an option, or to limit interregional travel? For the time being, no, because I think that the situation is so critical in all of Quebec. You'll find that I'm repeating myself here, but we're focusing so much on vaccination right now. And I would like us to be able to, well, perhaps Dr. Arruda wants to add something. I think that one of the things that we have to remember is we decrease contacts. Of course, interregional travel, especially if we go to a zone or Nunavik where there's not too many cases, let's say, it's riskier, and there will be some controls in planes, etc. We can't say when it's going to stop. Are we going to go back to the colored levels? Are we going to come to different measures between territories? Well, right now things are moving so quickly that we would rather have one approach. We don't know what the future holds for us, so I will never say never, but I think that for the time being, things are happening so quickly. It's spread throughout the world dramatically. Luckily, it goes up and then it comes back down. But we have to be prudent.
Merci. Monsieur le Premier ministre, on en est où dans les demandes qui ont été faites?
Mr. Premier, where are we with the requests that were made to the federal government to get help from the armed forces and also with the Red Cross? I know that you've been in discussions for a few days, but where are we with these discussions? Well, we got the okay from the Red Cross, but we don't yet have the number of people. Now, for the Army, we would talk about just a few dozen people, so we're getting organized without the armed forces.
Oui, bonsoir, messieurs. Je ferai un suivi sur la question de mon collègue, monsieur Bourassa.
I'd like to add to my colleague's question. When we compare the most recent hospitalization data by region, we realize that there are some regions, like Montreal, for example, that are much more, the situation is much more critical than in other regions. Given the disparity in the hospitals and the vaccine coverage, why not go back to a regional alert system? Well, there are several components in your question. I will start with the disparities, the regional disparities in vaccination. Of course, there are some regions like Montreal, like the Estrie, like the Montérégie, that have a rate of positivity that is much greater. And we can think the more the region is dense in terms of population, well, the greater the rate of positivity. And you will see that I'm repeating myself again. That's why right now our focus is on vaccination. The average of the rate of positivity that we had as of yesterday is at approximately a little bit under 15%, at 14.8, I believe, and it can go up in the Estrie to 22%. It's just to show you the differences. So before we can look at hospitals, I think it's important to clarify the rate of positivity. Now, when it comes to hospitals, up until now, there's perhaps the Estrie. That's a bit tighter than the other regions, and we, in the Estrie, we sent patients to other regions like Centre du Québec and La Mauricie when we got too close to our maximum capacity. But once again, the best way to avoid overwhelming hospitals in certain regions is to follow vaccination. And right now, Daniel Paré and his team are doing fantastic work on this. And WHO is saying that countries like ours, when they give a booster shot to their population, will just prolong the pandemic. In light of what's happening with Omicron, should we not make sure that developing countries who don't have access to vaccines, that they get their fair share of these vaccines before we give a booster shot to all Quebecers? We understand the concerns, and we've always said that we must get organized internationally to supply vaccines to poorer countries, because it's inequity that's catching us, that's catching up to us. On the other hand, we must also make sure that our population is protected and that we'll be able to treat people who have pneumonia or they need cancer treatments and protect our healthcare system. I think that both objectives are not mutually exclusive, but they're complementary, and there must be international discussions to allow poorer countries to have access to vaccination programs at adequate cost for them, as we've done in the past. For example, with the HIV therapy. It's an important question, it's an ethical question that concerns us, and we must work at different levels. As I've said, these two things are complementary.
Oui, bonjour. Je voulais revenir sur la question des...
Question. I want to come back to the question of quick tests. Can you tell me how many tests, quick tests, we've received since the beginning? And you said that you had other alternatives. What did you mean by that? Well, what we said over the past few weeks, and I appreciate your question, it's good to come back to this, we've received 6 million, which are in our daycares and schools. There's a lot of these quick tests that were not used either in daycares or in schools, and parents now have them. Up until yesterday, in schools, when we gave quick tests, when we put them in their kids' backpacks, the kids brought them home. So there's already a big part of the 6 million quick tests that were distributed already in daycares and schools. The federal government had told us that we would get an additional 4 million. 2.6 million has been received over the past few days, and they were immediately sent to pharmacies. So the pharmacies, our 1,900 pharmacies, have already received 2.6 million. We are getting another 800,000 in the next few days until we reach a 4 million. So I want to reassure people the 10 million that the federal has promised by the end of December, we will reach it, but we can ask for more. Of course, we see this internationally, particularly with the U.S., and that will answer the second part of your question. The U.S. are very aggressive right now in the quick test market. And we've told the federal government that if we have to be in the market directly as well, if the federal government cannot supply us quickly enough, well, we will go to market as well, like we did with masks in the first wave. We will go to the international market directly. Now, when it comes to the use of tests, you say just when we're symptomatic. The Ontario says the opposite. With the holidays coming, would it not be good if people tested themselves before gatherings? I know that we don't have a lot of tests, but if it can avoid a few outbreaks or cases, would it not be a good thing? I'll remind you of what Dr. Arruda said earlier, and I will invite all Quebecers to listen to this point well for the best use of quick tests. Tomorrow there's a technical briefing on this. I will also invite Quebecers to go see on quebec.ca. There's a very good video. It's around a 4-minute video, and it explains exactly when you get the tubes for the tests and everything. It's a 4-minute video. Watch it. It's very well made. But for the use, symptomatic versus asymptomatic, perhaps Dr. Arruda wants to repeat what he said. What we're aiming for, we want the test to detect as many people as possible, and we know that when people are symptomatic, there's a greater chance that they will get a positive test, and then the person can self-isolate and avoid transmitting the virus. If we start doing tests with asymptomatic people, many tests will be negative, and the use of the test to make an intervention will not be there. So, testing strategies depend on several elements, the epidemiology, the rate of positivity, the capacity, etc. We'll always try to compare from one country to the next. And even in countries where they were used quite a bit, they didn't necessarily get better results. It's quite complex in terms of strategy, but what we're trying to do is depending on where we are in our epidemiology, we try to use a test in the most effective way possible for everybody's benefit. Question. Hi. My question has to do with the use of N95 masks. Some unions are asking to make those masks available for daycare workers and for healthcare workers. Are you considering making these masks available for daycares and for the healthcare network? The experts' analyses right now, you're talking about masks in general or the N95? The N95. We've asked an opinion from the Institute. They're reviewing the literature because there are some clear indications for the N95, but it's not for everyone and everywhere, so we'll wait for this opinion. There will also be some analyses done because there are very few publications with Omicron. Omicron just arrived. There are some studies, clinical studies that are done in the field. The superiority of the N95 versus the surgical mask is not always demonstrated in real time. In the lab, it's superior, etc., but we're waiting for an opinion, and as soon as we have the opinion, we will adjust things. We will make sure that we have the necessary material to protect our healthcare workers and workers in different settings. Thank you. We will now go to the English questions.
My first question is for Dr. Arruda. I'm wondering if you're concerned at all about not having a full portrait of COVID cases in Quebec if we're not testing those who've come into contact with cases.
In fact, we always know that we cannot have the portrait of every case for different reasons. I could tell you that we got more than 50,000 tests done in Quebec, so I think we've got a good idea of the trends. Any system cannot detect all the cases, but comparing what is due, I think we are in a good position in Quebec to say that we detect cases. And I'm sure that in other provinces, and it's okay, they don't have necessarily the same capacity and they are detecting lower cases. But what is important is the tendency. So I think we are well set actually for that. And with rapid tests, we will change our strategy too. There is going to be some tests that are going to be positive that will not be informed to. There is going to be some who will try to get the information to make sure that we see what is going on. But I think what is going on, actually, we've got a good capacity to really follow and have a good portrait of what is going on.
Okay, thank you. And my second question is for Mr. Legault. For weeks, doctors have been saying we need to take Omicron seriously to reduce contacts and use rapid tests and boosters. Given the crisis we're in today, do you still have confidence in Dr. Arruda's advice?
Yes. And we know that some decisions or some recommendation of Dr. Arruda in the first waves help us, especially for the duration between the different vaccine. Of course, with the Omicron, we're learning, everybody is learning, and that's why as soon as he told us that we can reduce the duration between number 2 and number 3 dose from 6 months to 3 months, we did it. But yes, I think we're doing still better, for example, than United States in terms of hospitalization. So yeah, I'm very confident.
Thank you.
Next question, Global News.
Hi, good evening. A bit of a follow-up about the boosters. A lot of Quebecers are looking at Ontario and Alberta, and they're starting to see those provinces open it up for the 18+. I know you've said repeatedly that it will be happening soon, but what can the 18-plus crowd expect for the booster, since all health experts are saying it's so important to get it?
Okay, first,
or the third shot, I should say.
Maybe before I ask Dr. Arruda to complete the answer, first it's important to say that we think, and I think it makes sense, that we have to give the booster, the third dose, to the people over 60 years old. We know that right now they represent 70% of the hospitalization. So if I have the choice between somebody of 18 years old and somebody of 65 years old, I prefer to go first with 65. Second, specialists consulted by Dr. Arruda thought until about a week ago that it was better to wait 6 months between the second and the third dose. Right now, because of the Omicron, they think that it's better 3 months. So as soon as we had this change, we adjust the vaccination, and we went from 40,000 to 88,000 vaccination a day. So,
and I want to mention that because we made the choice of having 16 weeks or 12 weeks between the dose 1 and dose 2, makes that our people, and there is studies on that, are best protected than the provinces who decide to go to 21 to 28 days. You can see all kinds of publications telling that our level of antibodies is higher when we do this thing. The 6 months is still recommended from the Canadian Immunization Society. What we decided is that because there was Omicron with a lot of transmission, we can reduce it to 3. But at the same time, there is still a recommendation of 6. So we are adjusting the things related to the epidemiology. If Omicron was not there, and if we were not going to have a big outbreaks, we would have kept the 6 months. So it's very important to understand that. And when we compare, even with UK, they don't use the same vaccines, don't use the same. You know, in Israel, they use a very short 21 days, and that makes that sooner they detected going down the immunity, and they decided to put a third dose. But it's not at all the same situation, and I don't decide it by myself alone. There is a lot of experts around me and make our recommendations. Until now, the CIQ, le Comité d'Immunisation du Québec, have made good choices.
Okay, and my second question is, you know, everyone and their dog wants to be tested. We know that the testing facilities are at overcapacity at this point. What is your message for people panicking right now, thinking that they need to go and get tested as soon as maybe they have a sneeze?
Well, first of all, there's going to be auto treatment told, you know. If you looks like a cold, it's clear you can stay home, you have symptoms, but you don't have to panic. There is a lot of other viruses going on, actually. But if you have cough, fever, or are losing your other, then you can go to get tested. But I think if you have no symptoms, or if it's mild ones, you can also use an antigenic test at home and see the protocols. But all that is going to be explained. There is going to be tools in our website about what to do, what are the symptoms, when do I have to consult, when do I have to screen. That is going to be explained tomorrow, and there's going to be a lot of schematic infographics for population.
Okay, merci beaucoup.
Next question, Max Harold from CTV News.
Yes, my question is for Monsieur Legault. You had a very strong message for the unvaccinated, and I just wanted you to repeat that in English. And also, you said you were not closing the door to mandatory vaccinations, from what I understand.
The message I have for the unvaccinated is that first, they don't help themselves because it's clearly a higher risk for them not to be vaccinated. And also, it's important to tell them that they put at risk our healthcare network, because figures are clear. They represent less than 10% of the adult population, but 50% of the people in hospitals because of the COVID-19. So if they don't want to do that for themselves, they have to do that for the other people. And I'm asking them, if they really don't want to be vaccinated, to please stay home.
Okay. And secondly, I'd like to know if the government is considering asking asymptomatic employees who are currently isolating at home to come back and work in order to, bring some more people in to help out.
Well, we are discussing that right now because I think there is a need to get as many people in our hospital. That's the base, given how low our level of personnel is. But we will never do what is not necessary to be done, and we will always consider the zone where we need to do the sort of risk. And so this is why we have asked our local managers to suggest the way we should reorganize, because it's not the situation in each hospital. And this is the reason that, yes, this is something that we'll consider, but we'll manage the risk properly as we have done. And remember, and I'm telling that to the personnel, we have provided all the, what we call the PCE material for la protection and control of infection. So I'm just saying that we understand that this is a serious issue, but we will manage the risk properly over the next few weeks.
Will you make mandatory vaccinations for healthcare employees?
Well, I think we've tried that. We went from 91% to 98%. I think that now with the combination of 98% of our employees that are vaccinated, plus the fact that testing for those that are not vaccinated is mandatory, I regret to inform Quebecers that we have laid off roughly 500 of those because they would not accept to get tested. That's unfortunate, but that's the risk that we didn't want to take.
We'll go with Sharon from CBC News.
Hello, my question is for Premier Legault. I'm wondering, why is the province not choosing to be more proactive with this steep incline of COVID cases and hospitalizations that we're seeing? Why not put a stop to the Christmas gatherings completely, or at least reduce them dramatically, instead of just starting that on December 26th?
First, we have to all understand that we have the toughest measures right now in North America, even if when you see, for example, what's happening in the United States, they have, all proportion, keep in mind, 3 to 4 times more hospitalization than we have. So I think that we already have tough measures, and I think that what is important also is that we explain to the population that it's a personal decision. So you have to reduce your contacts. So yes, we may put some measures in the restaurants and in all kind of places, but of course we need the help of the population. And I think that that's very important to mention that also, and we have to do that not only for ourselves, but also to help our healthcare workers.
And for my second question, I know you were talking about people signing up to vaccinate on Je Contribue. I'm wondering if any of those resources will be redirected to testing, since we have clinics where people are waiting 4 hours.
Yeah, but this is exactly what we're doing right now. The priority is using the people that have signed for Je Contribue to be qualified vaccinators. That's the first thing. So the minute they are available, I'm just saying it's normal that a lot of them, I said, they would be available after the holiday, after January 3rd. So we are trying to maximize the number of those that will vaccinate immediately. But I want to salute also the doctors that have signed up. 150 of specialists have signed up just today to be helping during that that tough period that we have between now and New Year's Eve. So as soon as we get people that can vaccinate, we will add them to list. I'm just repeating, but yesterday we had 88,000 persons that have been vaccinated. That compared to about 30,000 less than 10 days ago. So we are progressing very quickly and ramping up to the level that we expect to be at least at 100,000 very quickly. That's our goal.
Last but not least, Jacob from the Canadian Press.
Good evening.
Good evening.
When we look at the rise of cases in Quebec, when we look at these new projections from the INSTQ today, it looks like we're seeing a really rapid rise in COVID-19 cases. Will this vaccination campaign come fast enough to really control the spread of the disease and specifically the Omicron variant here in the province?
Well, what we've seen from our expert that we consult, whatever l'INES, INSPQ, Santé Publique, we're using researchers from Laval University, they're doing an international survey of comparable countries. I'm thinking of a similar size, similar vaccination rate, thinking about Denmark, I'm thinking about Belgium. It's very interesting that the sooner we get to a high percentage of vaccinated people over 60, this is what our premier has said. The sooner we will get to those people over 60 vaccinated with the third dose, even if the history of the Omicron is short, we're having 15 to 20 days. This is the period that we're looking, even in Europe, to have enough data to confirm that this is the reason we put so much priority on vaccination. That's the good news. So we have, even in certain category right now, or with appointment being taken, over 50% of those populations. So the simple answer, there is one recipe for older people, is to get vaccinated. Doesn't mean that we should not have all the measures of distanciation, ventilation, and everything. But what we see in Europe is that we need to focus on people that are over 60, and that's what we're doing right now, in addition to our health personnel. That's critical.
When we see the rapid rise in the number of COVID-19 cases here in Quebec, more cases today than in Ontario, for example, did we underestimate how quickly the Omicron variant would spread in the province?
Well, it's very delicate to say what I'm going to say. The more we use, and you see that, the more we use rapid testing, those rapid tests are not being recorded. So before, when you were comparing Ontario and Quebec and with any other province, the benchmark was the same because we were using mostly PCR, to official recording of all the tests. Now, and this is true for Ontario, it's true for us, the more we'll use rapid tests, the more it will be difficult. I think the more I think we will see over the coming weeks is how many hospitalizations and how many intensive care, to me, will be more and more the reality of what we're, because then you have to be very transparent how many intensive care you have. So I'm just saying that so far we were looking at the number of cases, but more and more will move to other benchmark because the rapid test is changing the game.
And I think it's important when you take, like Christian said, the intensive care figures, you see that yesterday Ontario had the double, so 100% more cases in intensive care than in Quebec. So you have to be careful not to look only at the number of cases because it depends on the number of tests, but what is key really is to look at what's happening in intensive cares.
C'était la dernière question des journalistes, c'est ce qui met donc fin au point de presse. Merci beaucoup.
Alors, merci tout le monde encore une fois. Merci beaucoup.